everyone, welcome to another episode of AyeWonder. My name is Virginia Lee and this is Dr. Andy Lee. And today I wonder what autosomal dominant optic atrophy is.
Well, that's a very good question, Virginia. Autosomal dominant optic atrophy is atrophy, which is degeneration of the optic nerve, which does the vision, takes the information from the eyeball and sends it to your brain. And autosomal dominant is our way of saying it's an inherited disorder and it's inherited in a dominant fashion, which means as you know, you get one gene from your dad and one gene from your mom. And if you get the bad gene, because it's dominant, even if you have a good gene from your mom, if you get the bad gene from your dad, you'll have the disease.
Can you tell us first about the signs of autosomal dominant optic atrophy?
Yeah, so the symptoms and the signs of autosomal dominant optic atrophy are what you'd expect with an optic nerve disorder. Loss of vision, but it's going to be bilateral. It's going to be in both eyes because it's an inherited condition. And it's going to be a central scotoma, which is a fancy way of saying the center part of your vision is down. Typically, the vision is in the 2200 level of vision. The rest of the exam is normal, except, as the name implies, there'll be optic atrophy. And because it's an inherited disorder, it usually occurs when you're young, like a kid, or it can manifest in early adulthood, usually typically in the age range of 20s or so. And it presents as a painless and progressive and then static bilateral central vision loss with optic atrophy. There are no other symptoms or signs except for the optic nerve unless you have OPA plus. So optic atrophy plus, the plus is other mitochondrial based kind of functions like hearing loss, myopathy, and ophthalmoplegia.
Can you tell us about some of the tests that we can use?
Sure. So the first thing is making sure that in the differential diagnosis that you've excluded the other causes of bilateral optic atrophy. That's like toxic nutritional conditions, vitamin deficiencies. You're going to do a scan of the head called an MRI, and then a bunch of other tests for the usual infectious, inflammatory, and other conditions that could mimic an autosomal dominant OPA1 optic atrophy. But the test to define the genetic disorder is a gene test, and we can test that gene, and the most common is called OPA1, the optic atrophy 1 gene. There are different numbers, however, OPA1, OPA3, a whole host of numbers, but really this is the number 1. There's an analogous one that is mitochondrial rather than autosomal dominant. That one's called Leber hereditary optic neuropathy, but really this is the gene we're looking for.
Can you tell us about how we get to the diagnosis?
So you have to exclude all the other causes in the differential diagnosis. You're going to make a genetic confirmation, a molecular confirmation that they do harbor the gene. You're going to take a family history, and you might even test the other family members to confirm the diagnosis, but some people are a de novo sporadic spontaneous mutation. Once you've confirmed the diagnosis, unfortunately right now there's no treatment, but one day we'll be able to replace this gene. And gene therapy is here. As you know, a guide RNA with a genetic editing scissor called CRISPR-Cas9 has been developed, and you don't need to know that. You just need to know the Nobel Prize was awarded for it. And then once we get a viral vector that can take this gene and insert it into the place we need to go, we can do a cut and paste. So with CRISPR, we can identify where we need to go. With the genetic scissor, we can make the cut. And with the adeno-associated viral vector, we can deliver the paste of the new gene right directly in. Because the prognosis for this disorder is usually not good. You end up usually in the 2200 range, and that's legally blind, and you just stay like that. And so even though CRISPR-Cas9 and genetic editing is here, it's not quite ready for prime time, but it's coming in your lifetime. And you need to know what it is so you can test for it so we can eventually help these people.
All right. Thank you, and that was another episode of AyeWonder.